Welcome to My Body as Well. If you're dealing with stubborn weight gain or obesity, if you feel constantly tired no matter how much you sleep, or if you've noticed unexplained changes in your energy and digestion, your body may be whispering a warning you can't afford to ignore. There's a silent condition affecting millions of people right now, and most don't know they have it until real damage has already begun. In fact, up to 1 in 3 adults may be walking around with this condition without any obvious symptoms. It's called fatty liver disease. And if you've ever been told your labs are normal, but your body clearly doesn't feel normal, if you're gaining weight around your middle despite eating well, or if you're exhausted by 2 p.m. every single day, this video is especially for you. I'm Dr. Christy Mauldin. I've been a licensed chiropractor for 26 years and a functional medicine coach helping people support their health naturally and safely. I've worked with thousands of patients who felt dismissed by conventional medicine, and I've learned that timing and gentleness are everything when it comes to true healing. Today we're talking about fatty liver symptoms, what causes fatty liver, and how to begin the fatty liver healing process without shocking your system or making things worse. If you're looking for how to reverse fatty liver or how to fix fatty liver safely, you're in the right place. Let's dive in. The diagnosis: what is happening inside you? Let's define the issue clearly. Non-alcoholic fatty liver disease, also called nonalcoholic fatty liver disease or NAFLD, happens when the liver stores excess fat, more than 5% of its weight, and this has nothing to do with alcohol consumption. This is now the most common chronic liver condition worldwide, surpassing even alcohol-related liver disease in prevalence. We're talking about a true epidemic that's largely invisible. So what causes fatty liver? In most cases, it's driven by insulin resistance and blood sugar imbalance. Here's what happens when you eat, especially foods high in sugar and refined carbohydrates. Your pancreas releases insulin to help your cells absorb glucose for energy. But when insulin stays chronically elevated, which happens when you're eating too much sugar too often or when you're under chronic stress, your cells become resistant to insulin's signal. When insulin stays high, fat burning shuts down completely. Your body can't access stored fat for energy. Meanwhile, the excess energy from food has nowhere to go, so it gets stored directly inside the liver as triglycerides. That's why fatty liver disease and obesity are so closely linked. They're both downstream effects of the same root problem, metabolic dysfunction. The challenge is that signs of fatty liver are often quiet at first. Early on, you may feel nothing at all. Your liver doesn't have pain receptors, so it suffers silently. As it progresses, common fatty liver symptoms include chronic fatigue that sleep doesn't fix. You wake up tired. A dull ache or sense of fullness in the upper right abdomen just below the ribs. Unexplained belly weight gain, especially visceral fat around the organs. Brain fog and difficulty concentrating. Elevated liver enzymes on blood work like AST or ALT. If you recognize these signs of fatty liver, please don't panic. The liver is one of the most resilient organs in your body. It's capable of remarkable healing, but only if we approach it intelligently and with respect for your body's current state. Why you should not just detox. This is one of the most important points in this entire video, so please listen carefully. If you're dealing with obesity, chronic stress, high cortisol, visceral fat, inflammation, histamine sensitivity, or hormonal imbalance, please do not jump into a random liver detox program. I see this mistake all the time. Someone discovers they have fatty liver, they get scared, and they immediately start an aggressive detox protocol. Juice cleanses, fasting, high-dose supplements, dramatic dietary restriction. And what happens? They feel worse, their energy crashes, they get headaches, nausea, mood swings. Some even gain more weight. Here's why. When the body is already in survival mode, when cortisol is high, when you're inflamed, when your nervous system is stuck in fight or flight, aggressively pushing detox can overwhelm the system and trigger a deeper stress response. Your body interprets aggressive detoxification as a threat, and when your body feels threatened, it holds on tighter to everything, including fat. My approach is phase-based, and it's built on this principle: safety first, healing second. Phase 1 is not detox. Phase 1 is not restriction. Phase 1 is not fasting. Phase 1 is about calming the nervous system, lowering threat perception, stabilizing blood sugar, and reducing cortisol so the body feels safe again. Only after the system settles, usually after 2 to 4 weeks, do we move into deeper liver support and more active detoxification strategies. Timing matters more than intensity. I'll also be doing a separate video focused entirely on fatty liver disease and diet explained step by step, so make sure you're subscribed and hit the notification bell. And if you want guidance, you can follow safely right now. I've created a liver reset PDF that walks you through phase 1 without overwhelming your system. The link is in the description below. The foundation: diet is king, but timing matters. Once we have the green light, once cortisol has come down, sleep is improving, and your body is showing signs of safety, we will look at supporting the liver. In the meantime, we address everything through what you eat. But listen closely. Do not start with intermittent fasting if your body has been under chronic stress. When the body perceives starvation on top of existing stress, cortisol rises even higher, and fatty liver can worsen. Fasting is a tool, but it's a phase 2 tool, not a phase 1 tool. Phase 1 is about signaling safety through nourishment, not restriction. Here's fatty liver disease and diet explained in 3 beginner rules that you can implement today. Rule number 1, remove fructose, especially high fructose corn syrup. Unlike glucose, which can be used by every cell in your body, fructose is metabolized almost exclusively by the liver. When you consume large amounts of fructose, especially in liquid form like soda, sweetened coffee drinks, or fruit juice, it overwhelms the liver's capacity and gets converted directly into liver fat. This is one of the strongest dietary drivers of fatty liver accumulation. Read labels. Avoid processed foods with corn syrup. Even healthy foods like granola bars and flavored yogurt are often loaded with it. Rule number 2, nourish, don't starve. Eat regular, nutrient-dense meals with adequate protein, healthy fats, and fiber-rich vegetables. This helps stabilize blood sugar throughout the day, prevents insulin spikes and crashes, and sends your body the signal that food is abundant, and it's safe to let go of stored fat. Think of meals like grilled salmon with roasted vegetables and olive oil, or pasture-raised eggs with avocado and leafy greens. Rule number 3, embrace Mediterranean-style fats. Extra virgin olive oil, avocados, and fatty fish like salmon and sardines. Also, coconut oil is recommended. These fats are anti-inflammatory, support insulin sensitivity, and actually help the liver process and release stored fat. Avoid ultra-processed seed oils like soybean oil, corn oil, and canola oil, which promote inflammation and worsen metabolic dysfunction. I'll break diet down in much more detail in a dedicated liver-focused video that's coming soon. And if you want structure now, if you want a clear roadmap that tells you exactly what to eat in phase 1, the Liver Reset PDF helps you apply these principles safely and practically. The accelerators, supplements by phase. Now let's talk about supplements. Here's what you need to understand. Supplements should always match the phase you're in. Using the wrong supplement at the wrong time can backfire. Phase 1 is about calm, not detox. In phase 1, I focus on 2 key amino acids, glycine and taurine. Glycine supports bile flow, which helps the liver process waste gently without triggering a stress response. It also supports nervous system regulation and improves sleep quality, which is critical when cortisol is high. I typically recommend to start out with 500 milligrams per day, taken in the evening. Taurine supports bile production and flow, helps stabilize cell membranes in the liver, and has a calming effect on the nervous system. It's especially helpful if you're dealing with histamine issues or gallbladder sluggishness. I recommend starting with 500 milligrams per day, not too late in the day. Magnesium is another supplement I recommend to take in the morning or evening to help calm the nervous system and help with cortisol spikes and sugar withdrawal. These three supplements are gentle, they support foundational processes, and they don't push detox aggressively. Now, milk thistle is excellent, but it belongs in phase 2, not phase 1. Once cortisol is lower, once you're sleeping better, once the system is stable, milk thistle supports liver regeneration and resilience. It contains a compound called silymarin that has been shown in research to protect liver cells from damage and support the repair of liver tissue. Phase 2 is also where tools like NAC, berberine, and TUDCA become appropriate. NAC, N-acetylcysteine, supports glutathione production, which is your body's master antioxidant and critical for phase 2 liver detoxification. I recommend 600 milligrams twice daily. Berberine supports blood sugar signaling and insulin sensitivity, helping address one of the root causes of fatty liver. It's particularly helpful if you have elevated fasting glucose or hemoglobin A1C. I recommend 500 milligrams 2 to 3 times daily with meals. TUDCA, taurine oxycholic acid, is a bile acid that supports bile flow, reduces liver inflammation, and has been shown in studies to improve liver enzyme levels in people with fatty liver. I recommend 250 to 500 milligrams daily. These tools are powerful, but power without timing backfires. If you use phase 2 tools during phase 1, you risk overwhelming a system that's not ready. I've linked the specific brands I trust in the description below to help you avoid low-quality supplements that don't deliver what they promise. Healing starts with safety. Let's wrap this up. There is good news. Healing is possible. Your liver wants to heal, but it works best when your body feels safe first. You now understand fatty liver symptoms, the fatigue, the abdominal discomfort, the unexplained weight gain. You understand what causes fatty liver, insulin resistance, blood sugar imbalance, and metabolic dysfunction driven by diet and stress. You understand how to support liver healing safely by calming the nervous system first in phase 1, then moving into deeper support in phase 2. And you understand how to prevent fatty liver disease over time by maintaining stable blood sugar, eating anti-inflammatory whole foods, managing stress, and using supplements strategically. If you want help doing this in the right order, if you want a clear step-by-step plan that removes the guesswork, the Liver Reset PDF is linked in the description below. It walks you through phase 1 with daily guidance, meal ideas, and supplement protocols. And make sure you're subscribed for the upcoming video where I break down fatty liver disease and diet in complete detail, including meal plans, timing, and how to know when you're ready for intermittent fasting. If this video helped you, hit the like button so more people can find it. Drop a comment below and let me know. Are you dealing with fatty liver or do you suspect you might be? I will do my best to read every comment. Thanks for watching my body as well. Be gentle with yourself, trust the process, and be well.